Hi, it's Derek. Welcome back to the Samaritan FAQ page. And one of the things that people really have uh, noticed as a difference between Samaritan Ministries and other healthcare sharing groups, and certainly from most insurance, is this idea of being open to helping with natural types of healthcare, alternative types of treatments, those kinds of things. So that's been really great. I know my family's been a beneficiary of that being a part of Samaritan guidelines and so forth. So, um, but what does that mean? You know, a lot of people think, "Oh, this is great." You know, I this is what I do all the time. I go to my naturopath every 6 months, and they run tests, and we do, all this kind of thing, or whatever it is. So that may mean something different to everybody. So what you want to think of in terms, before we talk about any of this, is just kind of separate out this idea of treatment for a condition versus going in to check things out. You know, routine, preventative, is something going on, or does my hair say that my vitamin Q level is a little high, whatever it is. I'm just being silly, obviously, but I think that a lot of us do that kind of thing, and we think of that as, well, this is what I would want my health insurance to pay for, is that kind of thing. Well, that is something that is different than really what Samaritan members are helping with. Samaritan members are helping with that unexpected medical issue, an illness, an injury, a set of symptoms, a spot, a lump, something. There's something there, and I'm feeling pain somewhere. I'm feeling, and so that really is what is being addressed by the sharing process. And so, if you can get that context going, and this goes with a lot of the things I've said in these videos, but if you can get that context in your mind, now you can then turn around and understand the kinds of things that Samaritan would help with. So, for example, if you have this unexpected issue that comes up, and you say, you know what, I want to go to the naturopath, or I want to go to, this really cool alternative care guy I found out about, just over the state border, or whatever it is. I want to get the natural treatment done, or I want to go to a different country. With Samaritan Basic or Classic, you can actually do that. And so that's really the idea. So for a lot of people, this is, on the bigger end, a cancer need. I don't want to do traditional radiation, chemotherapy, surgery stuff for my cancer. I want to do, this thing in Mexico, this thing in Germany, this thing here in the States, but I have to go, somewhere kind of far away. Or maybe I'm not. Maybe it's not far away. Maybe it is somebody close by that'll do something that you really want to do for that treatment. You have that option if you're going to a keyword licensed practitioner, licensed in your state to do that kind of medical care. Then you can go there. Now you say, well, what if it's just certified and they're not licensed? What if my state doesn't have a license for that? Well, then what you want to do is get someone who is licensed to prescribe that particular treatment for your condition to be done by that certified person, if that makes sense. So that's kind of the way you want to call the member care center if you have that kind of an issue. Make sure you get a clear understanding on what that's going to look like, if they need to write up some kind of a treatment plan, and that kind of thing. Well, what about supplements? Supplements, yes, 4 months, just like prescriptions. 120 days supply is shared as a part of the process. If the prescription goes on longer than that for the treatment of that issue, that's something you would pay for and take care of on your own. So that's the that's a lot of the natural treatment. But yeah, maybe you want to do, there's a lot of different things. Everybody feels different. I don't want to go mentioning a whole bunch of specific natural and alternative treatments here, but a lot of people have a lot of different ones they're going to do. It needs to be show some kind of effectiveness somewhere for that particular kind of condition, rather than, just being completely, well, my doctor said if I drink a gallon of gas every day, I should be able to clear this up. Yeah, you probably clear anything up drinking a gallon of gas every day. Yeah, you'd be, you know, be with the Lord. But at any rate, the great thing about Samaritan is that those kinds of things can be shared. You still budget for your own routine and preventative care. You want to go to that naturopath every 6 months and run all the tests and do all the stuff and make sure you're healthy and make sure you got all your levels where they're supposed to be and that stuff. That's all great. That's not shared by Samaritan. So you just want to be aware of that kind of thing and know that Samaritan is there for those other things. Maybe it's a chiropractor, throw out your back, you want to get some adjustments, totally fine. Up to 40 visits to the chiropractor is shared. Minus that first 300 if you're in classic, of course, minus that first 1500 if you're in basic. But that is definitely, those things are definitely options. So I want to encourage you. Samaritan is going to be the top pick by a landslide in this area. If you're looking at various healthcare sharing ministries, you want Samaritan if that's a priority for you. So that's my take. Have a great day. Hey, put Derek Thorpe video on your application if you decide to sign up. If you don't know somebody who's already a member, like, subscribe, all that good stuff. I really appreciate it. Have a great day.